I wanted to look at the timeline around the cluster of neurological syndromes with an unknown cause. So, as I understand it, in December of 2020, the Creutzfeldt-Jakob surveillance disease system folks concluded that none of these cases were CJD, which were 33 at the time. And then by January, the Creutzfeldt-Jakob folks had contributed to creating a case definition for the syndrome of unknown cause, which was accepted by public health. Is that right?
Yes, and that case definition was created largely with CJDSS, but in partnership with the primary referring clinician in terms of creating that case definition.
Right, but it's not something he created himself. It was done in a collaborative process here with this Creutzfeldt-Jakob experts.
Yes, Creutzfeldt-Jakob.
Yeah. Okay, so then in February, once the case definition had been created and was accepted by public health, a multidisciplinary team of provincial and national partners with subject matter expertise were organized to carry out the investigation led by public health. So that was February 2021, is that right?
And I would say that multidisciplinary team had come together, one, to do some hypothesis discussions, but it quickly became clear there was a need for an epidemiological survey. And those experts, both national and provincial, across areas, which are well listed in the report itself, they helped inform that epidemiological questionnaire.
Okay. So during this period, in trying to investigate what was going on here, did public health contact those with expertise in the neurotoxins associated with harmful algal blooms like blue-green algae? It's a growing area of research looking at the human health impacts of those toxins, particularly in shellfish and marine invertebrates. So this work has been widely published on this. So did public health or the department contact any of the prime researchers in that area?
Those individuals were part of that multidisciplinary team, and certainly that was one of the hypotheses that was thrown on the table, and certainly that is why public health, working with the LG partners, had instructed to do some water testing, just preemptive. This is prior to even having the epidemiological survey being started with the ultimately 48 individuals part of that cluster. So again, very much hypothesis, not at the time anything that would have indicated, because that epidemiological survey had not been conducted, that was even a potential risk.
So, as long ago as 2014, experts in the field have published in the scientific literature that the data suggests invertebrates collected in water where cyanobacterial blooms are present, if consumed, may result in direct human exposure to these neurotoxic amino acids. And in a most recent contribution to a respected journal, the conclusion suggested that there's an increasingly large body of data from multiple independent labs using orthogonal methods which provide increasing evidence that chronic exposure to BMMA, for example, one of the toxins associated with blue-green algae, may be a risk factor for neurological illness. So why was sampling not done of tissues, either human tissues and invertebrate tissues to look for BMMA.
Well, I can tell you there was an extensive DFO report, and that's also referenced in the report that Public Health put out. In addition, CFIA standards in terms of the appropriate treatment and sanitation of consumed shellfish and other types of invertebrates are very, very robust. There's nothing in that process that would suggest that anything untoward would have ever happened in New Brunswick. I know when the lobster scare from Maine had taken place, they had done extensive work in and around the Atlantic provinces to make sure that there was nothing similar here.
Well, but the challenge, of course, is that the algal blooms of blue-green algae are periodic. They bloom and then they're gone, and they're dispersed, so they're not always in the same place. And you've got to have all the stars align in a sense to have a situation where shellfish might be exposed to BMAA. So it's not something that's going to be happening consistently all the time in the same place. So whether it's in shellfish or whether you're looking at water, it's going to be related to the timing around the blooms.
So Public Health, along with ELG Partners, that is monitored, and we have been alerting the public of algal blooms for a number of years now. We really wanted to take a systematic approach to this, which is what is appropriate in this kind of investigation from a public health perspective. All public health processes were followed in doing an investigation of any kind of outbreak, whether it's something unknown or if it's something even potentially known. So that epidemiological survey was the most important component. For example, even some of the early hypotheses were that cervid meat was likely the driver. But that epidemiological survey did not demonstrate that cervid meat was a common consumed product for those individuals. And so at the end, when that epidemiological survey could not point to anything environmental, behavioral, or foodborne, we had to move forward with that clinical evaluation. And as that oversight committee of 6 neurologists chaired by the 2 VPs from each of the RHAs, along with a brand new medical officer of health with an epidemiological background to our province, did that clinical review. None of the 48 individuals met the case definition criteria, and all had other possible potential diagnoses. And so with that in mind, and those are listed in the document as well, the report, and really if we look, and if we had gone off into a tangent and looking at one particular potential related cause, we would not have gotten to the end point. And at the end of the day, it was about these families and making sure they were receiving the appropriate care and treatment that they needed as quickly as one can move such a process, as well as understanding, it takes time to elucidate diagnoses for neurological diseases. So, and then within that time, we also had the autopsy reports of those individuals, and as well, there was the abstract published by one of the neuropathologists that had done most of the autopsy within this cluster. And so from a statistical and scientific approach, it really eliminated the possibility that, even at that point, that there could be a cluster. But we certainly carried out and made sure we completed all 48 clinical reviews by that oversight committee, and ensured that that unbiased group finished their work and provided that to public health so that we could make our final recommendation.
You say you ruled out deer meat from the epidemiological survey, which I can see from the results why you would, but one of the things that links all of those people is their consumption of shellfish, which points then directly to should you not have taken measures to rule out BMMA as a potential factor?
So we have to compare those percentages with what is would be considered regular consumptive rates for a population within those areas. And we're not talking about daily consumption. We're talking about, this would be any kind of consumption within the period that they look back, that 2-year period. And when the DFO had done their evaluation, and even then looking at where do toxins accumulate, and that's usually the tamale of lobster, for example. Our understanding is that you'd have to eat 5 lobsters a day. I can't even remember for how many days, but
Safe consumption guidelines are 1 a day.
1 a day, okay, yes. Safe consumption guidelines, it would be have to eat a lobster a day. That is still considered safe, even if you ate the tamale. So we did not see that this was a risk factor.
But those guidelines are not based on BMMA, is my understanding. They're based on other contaminants.
Those guidelines undergo regular review, and based on new evidence and findings, they do get updated. I can't offer you today what that would have meant, but from our perspective, this would have been a tangent to the research that needed to happen.
I don't know why you say it would be a tangent to the research when, in the literature, you get conclusions like the one I mentioned earlier, which suggests that there's an increasingly large body of data from multiple independent labs that provide increasing evidence that chronic exposure to BMAA may be a risk factor for neurological illness. I mean, that's increasingly the kind of conclusions that exist in the scientific literature on this. So I don't understand why you call it a tangent.
There are studies, yes. However, the volume of studies for that is minimal compared to the volume and breadth of data and evidence on the safety of not just shellfish, but our food supplies in the country. So from a scientific standpoint, when we look at evidence, we really have to look at the quality of the evidence, the volume of the evidence, and we're really not the experts. We turn to experts to help provide us with guidance. So that is really where we landed based on moving forward with that epidemiological survey and what that epidemiological survey meant. It directed us in the right direction.
Well, that's why I started out by asking you whether or not you had consulted the foremost experts on this, who are doing quite a bit of the publishing and are associated with the brain chemistry lab in Wyoming, or not. I mean, this area of the impacts of harmful algal blooms is growing because harmful algal blooms are becoming more and more of an issue. They weren't before. It's a let's say a new and growing phenomena that's developing yearly as a result of increased nutrients in the system and warming of the waters and all the rest of it. So you can't look back, you got to look forward. And I just am surprised that you would call this a tangent. Even federal experts on the original committee suggested that BMMA should be something that needs to be ruled out because of the body of evidence that was developing in the literature.
In terms of the information having, and the Oversight Committee's report and Public Health New Brunswick's report, and sharing that with our partners at the Public Health Agency of Canada, they fully supported the findings and the work that had been done here in New Brunswick. We also have other experts that have reviewed that information and have come out publicly in support of the information and the process and the findings that we have here in New Brunswick. Early on, there was a memo that was distributed throughout New Brunswick for anybody who may, see this, and this was also sent through a federal channel so that all provinces could look and watch for this. We have not received any other cases from outside of New Brunswick, and so we really are focused on the fact that there were other potential diagnoses for these individuals based on that Oversight Committee's report, and everyone is certainly able to have follow-up, whether it's at the Mind Clinic or with experts within our province, but also we're offering to support second opinions outside of the province as well for all 48 individuals that are